Well, it's alright. Riding around in the breeze. Well, it's alright. If you live the life you please. Well, it's alright. Doing the best you can. Well, it's alright. As long as you lend a hand.
Hi, I'm Dr. Mark Jagger, and what you're watching right now is a treatment of laser-assisted meniscal decompression in action. So what we're trying to do here is traction the knee to the point where we create a little bit of space in the knee joint to circulate the synovial fluid, so the lubricating fluid in the joint. The device here, you'll see, is a traction unit with a harness that attaches to the ankle and a bolster that supports underneath the back of the leg to isolate the knee joint itself. So we have it on a cycle where it pulls for 10 seconds, relaxes for 10 seconds. So we get flexion and extension of the knee along with axial decompression or traction of the knee joint itself. Now what we're going to add to this is simultaneous laser therapy. Once the traction amount is up and there's some space achieved in the knee, we're going to apply class 4 laser therapy to increase the circulation, help enhance the healing in the soft tissues, and the distraction will actually increase the space between the bones, allowing the laser to penetrate a little bit more deeply. Okay, now you'll see the laser has been armed, so we're ready to begin the laser therapy component of this treatment. So the laser is done simultaneously along with the traction. The advantage of that is as we're separating the bones out under traction, we can actually get the laser to penetrate a little bit deeper. Creates a little bit more space for the laser to travel deeper into the joint. The other big advantage with the traction is you're actually increasing the amount of circulation of the synovial fluid, so the lubricating fluid of the knee. So when a knee's been compressed and there's cartilage damage, there won't be a lot of space between the bones and the cartilage. The piece of meniscus or cartilage that the femur, so this top bone here, sits in, will actually be compressed against the cartilage. So in distracting them, we allow a situation where the lubricating fluid can get between the surfaces that it should be between. So we'll just proceed here with the laser. So this red here, you can see the laser. We're going to start applying. You'll hear a beep. The laser will get a little bit more intense brightness. But it's just a very light warmth that the patient is feeling. So this is a 10-watt class 4 therapy laser, one of the higher powered ones available. And we've got it in 1-minute cycles. So we're going to do approximately 3 to 4 minutes of laser around this knee here, around the entire joint surface that is exposed here. And just in this manner here, just to allow the laser to penetrate a little deeper into the knee. So as you see here, we're working on the inside of the knee here. This particular patient has a medial meniscus problem along with medial collateral ligaments. So one of the ligaments and the cartilage on the inside of the knee here has got some issues with it. Quite a common problem. This was from an athletic injury. We're concentrating the laser on those two structures on the medial side of the knee where a lot of the pain and damage is, under the traction. So again, we concentrate about 1 minute on this area normally. We're going to concentrate about 2 minutes over here just because we're concentrating on exactly where the injury is. So one other thing to note with this treatment, the traction and relaxation phase cycles. Now the importance of that, we go from about 0 to 40 pounds of pull, cycling back and forth. Now as you can see, as the traction releases, the patient's knee will flex a little bit. Now the importance of that is that the knee is in relatively constant motion throughout the treatment. In flexion and extension, there's a hold at 40 pounds and a hold at the 0 to help the knee relax. but as we're doing this motion, it really does, the dynamic aspect of this motion helps circulate the synovial fluid, the lubricating fluid around the joint. So that's one very important component of what's going on here also. So it isn't just a traction and a hold with the laser. We're allowing the machine to do a dynamic motion to help the circulation in the joint that much more.